Distinguished colleagues and friends, thank you for the opportunity to contribute to the conversation about building a world where no one is left behind. Our 2021-2030 Child Protection Strategy sets equity and inclusion as a key objective and also identified strengthening social service workforce as a key approach to achieving inclusive systems. UNICEF strategic plan recognizing strengthening this workforce as a priority area of investment in child protection. So, who is the social service workforce? It includes government, non-government professionals, and paraprofessionals, including community workers, who carry out a range of essential promotive, preventive, and responsive roles. As you know, social service workers build on their existing strong ties to children and families and communities to respond in ways that are effective. They play a vital role in ensuring that quality social services are available to address a host of vulnerabilities of children and families by protecting children from violence, abuse, neglect, and exploitation, alleviating poverty, promoting social justice, reducing discrimination, and challenging harmful behaviors and social norms. For example, the Child Protection Volunteer Scheme in Kenya has been highly effective in identifying vulnerable households and their needs. It is a proven model to strengthen community-based prevention services that are central to child protection systems. Local volunteers work closely with officers to provide child protection outreach services, support, and referrals in case management. In 2018, UNICEF conducted an evaluation of our work on child protection system strengthening. It confirmed that these systems are more effective in protecting children when a qualified social service workforce coordinates efforts and resources and provides a system of support for children and families by connecting them with critical services. The fundamental role of social service workers was brought to the forefront throughout the COVID-19 pandemic, as they are often the front line of response for vulnerable children. Amidst this global crisis, we saw how they were the front line for every child despite challenges in access to children and the family due to varying restrictions. To address these challenges, UNICEF worked with countries to ensure social service workers were designated as essential. And in 2020, at the height of the pandemic, we saw a shift in national effort to focus on ensuring the continued provision of social service care, such as expanding online case management and the availability of remote learning methods. Again, for example, in Ethiopia, they used a teleconferencing approach, transmitting messages on case management, mental health and psychosocial support, and prevention of sexual exploitation and abuse. This involved a cascade method where 8 senior social workers were trained, and then these workers trained another 50, who then engaged with 1,500 community service workers through small group telephone calls. And through remote learning method, over 1,100 social service workers were deployed in 2021, reaching almost 27,000 children. These innovative approaches demonstrated how we could ensure the workforce was able to deliver critical services without interruption, even in the midst of the pandemic, to children and their families in hard-to-reach areas, marginalized communities, or during crisis situations where access is limited. In 2021, UNICEF capitalized on opportunities which rose from the response to the COVID-19 pandemic to strengthen the humanitarian development nexus and reinforce the central role of the social workforce in emergency response. An example of this is in Democratic Republic of Congo, where UNICEF worked closely with DIVAS, D-I-V-A-S, the government social service division, where they continue to scale up identification and referral capacity as part of the expansion of a parasocial worker model. The role of divas as a primary respondent in emergency response to the Ebola outbreaks and natural hazards, such as the volcano eruption in 2021, has been recognized by the sector at large and reinforced. Through this capacity building, social workers were able to reach almost 440,000 children in 2021, twice as many as in 2020. Colleagues and friends, without a strong, well-supported social service workforce, we cannot hope to ensure every child is protected from violence, abuse, and exploitation and harmful practice. Nor will we achieve the ambitious SDG targets related to child protection. Indeed, an estimated 65% of the 169 targets underlying the 17 SDGs will not be reached without engaging local and regional authorities responsible for social services to help strengthen services and the workforce responsible for delivering it. Yet, we continue to witness significant challenges in securing long-term investments to strengthen and expand the social service workforce, despite the essential role in every well-functioning child protection system. This workforce continues to be under-resourced and under-supported. To address these challenges, UNICEF collaborated with the Global Social Service Workforce Alliance to jointly issue the first ever guidelines to strengthen the social service workforce for child protection in 2029, along with a mapping toolkit, online course, and other resources. Since its launch, we have seen a positive uptake by governments and organizations, but more action is needed to sustain progress in a more comprehensive and sustainable manner with strong national leadership and ownership. We must identify and map out what is required to ensure the social service workforce is adequately resourced to meet the needs of the population. 2, we must raise the profile and institutionalize the role of its workers through national legislation or programs. 3, and we must develop education and training programs based on real-life context with long-term opportunities for career growth, development, recognizing the diversity of this workforce. UNICEF looks forward to continue its long-standing partnership with the Alliance, government, civil societies, and partners across all regions to accelerate regional and national effort towards a more inclusive system and society by strengthening its social service workforce. I thank you.